I first heard about the community paramedic program probably late 2014, early 2015, and then it started here in the fall of 2016.
As a community paramedic, we do preventative care. We try to keep people out of the hospital or out of the emergency room by visiting them on a regular basis. In the beginning, when I started being a community paramedic, I didn't really know exactly what to expect. I had to learn to sit and not worry about, how many patients I see that day or how much I get accomplished, but the quality of work that I provide every day for the need of each individual patient.
Our interprofessional team meets every morning. We have huddles for 15 minutes, and we discuss some of our most vulnerable patients. Our community paramedics also attend our huddle. And with those people, we have discussed as a team, who do we see would benefit from the community paramedics actually attending their home. We do have quite a large percentage of aging people.
They don't get a lot of interaction, so by us checking in with them on a weekly basis or sometimes twice a week if needed, it makes them feel safer because they know that we're coming to check on them, that we're there to help them.
Hello, Dale! Are you home? Good, how are you today?
I appreciate it when they come and see me anyway. I know it helps me, and I kind of look after my blood sugars a little better than I used to because of them, because there isn't one there, so yeah, I think it's a good thing.
It just helps us identify things a little earlier. If they're continually seeing these people in their home on a weekly basis, they may notice a bit of decline in their health, and then we can respond quicker. In the past, people sometimes would just end up in a crisis and then come in by ambulance, and that's how we would be aware that they had extra needs.
The program was highly recommended to me by a few staff members at school. I was looking for basically some things to do with my family studies class that would be applicable to life skills and just kind of personal development. And Cathy came in and led a workshop on naloxone training, stopping issues with major bleed, as well as first aid. So it was nice that the kids definitely got value from it and they could see that it wasn't an everyday thing to get to do. Looking forward for next year where we could have like a more permanent thing because this was so successful.
Community itself, the population is probably around 1,200. We have the surrounding communities of Endako, Fort Fraser, and then the two First Nations communities of Stalaco and Notley.
We get Cathy to do the off-reserve people that can't get to town and stuff like that. So it's been a big help. They go and check on them all the time. They do their blood pressures. If they're diabetics, they'll get their meds for them. So for somebody to fall through the hoops now, they wouldn't happen.
Cathy's referred us quite a few clients now through the Better at Home program through United Way, and those clients now get light housekeeping and yard work help and friendly visiting as well, on top of the care that they're receiving through the community paramedic programs. The resources and these extra supports in place, they will have to leave our community way earlier in their lives, and we don't want them to have to do that.
We try and build that connection for them, that they feel like there's people there that care about them, so that they can live at home healthier and happier and safer.